Radio Pulpit invites all ladies, young and old, whether married or single, to join the Radio Pulpit camp taking place from the 5th to the 7th May 2023 at Chakana in the heart of the Mabula Game Reserve in Bila. We all felt alone at one time or another in our lives, and we keep searching for connection. Come to the camp and find some answers. The theme for the weekend is Inquisitive Beauty that Desires the Fellowship of the Holy Spirit, presented by Pastor V.T.J. Masagona. The cost for the camp is 1,750 per person, and you're welcome to pay in portions or segments. An additional fee will apply for those who need transport. For more information or to book your place, contact Zandile on 012-334-1231 or email at zandile@radiopulpit.co.za.
One vision, one voice, one message. Radio Pulpit 657 AM and 729 Cape Pulpit, impacting lives from Gauteng to the Cape.
A good morning to you, my family. How are you doing? I hope that you're good. It is just for you. My name is Sibongile Mofokeng with you up until 11 o'clock, and we are entering into Huis Besoek with Dr. Tlailane. But before I greet him, we gave you the sounds of Mabongi Mabaso praises, and that's how we came out from that teaching and nugget by the late Dr. Derek Prince with the word from the word. And before that, we gave you the sounds of Johan van Rensburg and the song Dumela, have faith in God. And he says, all you need to do is have faith in God because all things are possible through him. And yes, Dr. Tlailane is in the studio with me. And let me just take a moment and greet Dr. Tlailane. Dr. Tlailane, good day. How are you?
I'm fine. How are you, Bongi?
I'm blessed of the Lord.
I'm here today.
Yeah?
Yeah, to be with the family again.
It's always awesome to have you in studio.
Yeah, I also miss you. Hey, a month is long.
Well, we thank God for every moment that he makes it possible for us to meet. Now I'm like, we're talking salt awareness.
That's right.
Today. And yes, I said to the family, and I'm still saying it to the family, you can call in and ask about any medical issues that you have that you'd like to ask Dr. Tlailane on 012-334-1322. It's 012-334-1322. Alternatively, you can drop us a WhatsApp on 082-657-2729 or 082-657-2729. Alternatively, our SMS line is also available on 37871 37871. And so I was thinking, I'm like, qualification in the township, when you're taking Litswai, they talk about Litswai in a certain way that if you don't engage in sexual intercourse, then you will have what they call salt, Litswai. And of which I don't think it's true.
No, it's not true.
No, I don't know who did that research.
Why is it? A lot of scientists who research all these things here in the township.
Self-acclaimed scientists.
Self-acclaimed scientists.
But we are looking at sodium, the importance of it and the dangers of it
That's
today.
Right, yeah. And then he spoke a little bit about it. He took the words out of my mouth.
Yeah.
Okay, fine. Basically, salt. Let's see, salt. We know that salt is an essential health commodity that all animals really need.
Oh.
And then what we really need out of this salt is basically the sodium part of it, because it has to be working with the potassium, which we also absorb.
What are the components of salt?
Of salt is sodium plus chloride. Chlorine,
yes.
Yeah. No, not chlorine.
Sodium chloride.
Sodium chloride, yeah.
So we don't need the chloride in it?
No, not so much. You don't need chloride so much unless, if you have fortified the salt for people who've got dental caries or because they need the fluoride. Or maybe have got some bone problems, or you've got osteoporosis, or you've got some chronic kidney disease, or there is an impending cancer developing, especially that of the pancreas.
Then you would need chloride from the salt.
From the salt, yeah.
Yeah, but most of us just need the sodium.
We need the sodium, yeah, that's right. Now, salt is a mineral composed primarily of the sodium chloride, which is a chemical compound which is found usually either in this deep down in the earth or in a sea.
Okay.
You know, it all depends where you get your salt from. There are those who prefer sea salt. There are those who prefer ground salt. The difference, there isn't much of a difference except the one is...
Really?
Yeah, there isn't much of a difference except the one is more fine. The other one is not so fine.
Coarse. It's coarse salt.
Yeah.
You know, we are told, get sea salt. Get sea salt. Stay away from, I think they say iodized or something like that. Salt.
Yeah, well,
iodized
they're all
salt.
fortified.
Yeah.
We fortify this thing like during the olden days. What they used to put in the salt is iodine, because we know that iodine is very good for thyroid, for the thyroid. And then if you have got deficiency of thyroid, deficiency of iodine, then you are likely to get a goiter.
Yeah,
so
where you have like what, a bump on your...
Yeah, it's a big lump in front of your neck.
Is it on the throat or is it...
No, it's not in the throat. It's outside.
Okay.
On the anterior aspect of the trachea. Yeah, because that thing, if it can grow, it can actually choke you and you can easily die. But fortunately, it's a slow growing tumor. And then they also fortify it with some chlorine. They fortify it with some seasoners, which are necessary for people who are deficient in other elements. Like, our body is supposed to manufacture and extract from the fruits and vegetables that we eat. But somehow, in some other diseases which are genetically inherited, the body is not able to can metabolize those things. So that's why we need to fortify. Now, when you fortify, we fortify it in the salt, like in iodine and then in a fluoride for people with dental caries, as I said. Now, before we can proceed, let me just give you some, the sodium chloride, sodium consumption and health, the basics, and then we can just discuss around them.
Okay.
Now, the table salt is made up of just about 40% sodium by weight. So a 6 gram serving, which is about a teaspoon, contains about 2,400 milligrams of sodium. Yeah, of sodium, 2,400 milligrams.
A teaspoon.
Yeah, a teaspoon. Now, you don't put the whole teaspoon in your plate, do you?
Not in the plate.
Yeah. Now, sodium serves a vital purpose in the human body via its role as an electrolyte. It helps nerves and muscles to function correctly, and it is one of the factors involved in the osmotic regulation of the water content in our bodies, the fluid balance. Like, if you look at a patient with a heart failure, his edemators, he's got a lot of fluids inside there. And then now what happens there is because there is too much retention of sodium.
Okay.
That's why we restrict the hypertensives and...
to take too much salt.
Yeah, we restrict them from taking too much salt. And then now that patient, his edemators, has got a lot of fluid. And then for one to treat that, you're going to give something like a diuretic, Lasix, which is it's not ethical. No, Lasix is Lasix, or furosemide to get rid of the water. Now, what happens is it loses the sodium. Now, that sodium is going to be exchanged with potassium. That's why we have to replace the potassium, which is lost, with the sodium.
Okay.
So that we don't get muscle cramps.
Yeah.
Yeah. You will, if you get Lasix and they are not replaced with potassium, you are going to lose everything, including the sodium. But the potassium is the one which is going to be retained and cause you cramps, muscle cramps.
Okay.
That's why some other people who are on treatment for heart failure, they develop these muscle cramps. But
what about blood pressure patients as well?
No, the blood pressure, okay, fine. The blood pressure will go down. Because the volume is going down.
Okay.
And then now what goes down especially is the systolic blood pressure and not the diastolic.
Okay.
And then we know that the diastolic is the one which is more important because it determines the basal pressure that every tissue needs in the body for its sustenance to get nutrients, oxygen and glucose. Yeah.
So it's not common for those that are treated for hypertension to have these cramps?
No, it's common.
Also for them?
Yeah, if you don't give them potassium, they're going to have these cramps. So you have to give them potassium to replace the potassium that you lose in the urine.
Let me ask.
Yeah.
I've heard of many patients who are on, who are for high blood pressure,
Yes.
who experience these cramps, and most of the times they are at night, and I think they call them night
that's right.
cramps.
Yeah.
Is it because of what we're talking about?
Yeah, it's because of that potassium which is being lost. You'll find that they are being undertreated. They're not being given the supplements, the potassium supplement that they are losing in the urine.
Oh, so
Because of the
there should
diuretic.
be potassium also.
Yeah, that's
A supplement in
yeah.
in their
a
treatment.
Yeah. So now the habitual salt intake in many Western countries is about 10 grams per day. Yeah, and it is higher than that in many countries in the Eastern Europe and Asia, and with us too here. Now, the high levels of sodium in many processed foods has a major impact on the total amount consumed. Now, that's why I've got a problem with processed foods. That all the Viennas, the Polonies, these have got such a high content of salt. And once ingested,
And we are not even aware.
yeah, we are not even aware.
Wait, is salt addictive as well, like sugar? I know sugar is addictive.
I heard you speaking about that. I don't know if we are being addicted. Maybe you are just being
Acquired? It's like an acquired taste of some sort. You want that
that's
all
right.
the time?
You want it all the time.
Yeah.
Because remember, an addiction is something that it's not easy to get rid of. Once you're addicted, you're hooked. Yeah.
Yeah, but okay, so you say processed foods.
Yeah.
I
processed
know
food.
our sources. Ooh.
Yeah, no. A lot of all this, they've got. That's the salt is the one which gives them taste. See that?
So we would put a teaspoon of the salt, the dry white salt in the food, then the sauces and the spices.
Yeah, that's right. And then you'll find that you're eating something like 7 to 10 grams, which is almost over about 70% of
You're
what
not
your
even
body,
aware.
Yeah, what your body requires.
Should we be pouring salt in our food at
No,
all?
we shouldn't really, because all
Because
the
I
foods that
understand,
we have,
yeah, potatoes have got their own
they've
salt.
got all this salt, the salt that you
But
need.
it's funny, to be honest.
Yeah.
It doesn't taste too good.
That's right. Now, the high level of sodium in many processed foods, as I said, it causes a major impact on our total amount consumed. And then we should be very wary if we put salt in these things. I've seen some people, boerewors. Boerewors is salted already.
Yes.
And people put salt on top of that.
And spices.
And spices.
And oil. And put it in oil.
Yeah. Now, in the United States, 75% of sodium eaten comes from processed and restaurant foods. So, I don't want to discourage people from eating from restaurants, but it has been researched that restaurant foods, you see, they're very tasty and everything.
Mm-hmm.
They've got a very high content of salt. Now, 11% from cooking and table use, and the rest is found naturally in foodstuffs. Like, as I said, 11% we get from this fortified salt that we put in our food, and then the rest comes from the food that we eat naturally. Now, because consuming too much sodium increases risk of cardiovascular disease, health organizations generally recommend that people reduce their dietary intake of salt, and then if you can at least try to reduce sodium intake to about 1 milligram per day, that should sort out your osmolality and your cravings and other things, and you may not get these hypertensive events and cardiovascular diseases, strokes, kidney disease that we all see, because a reduction in sodium intake to about 1 gram per day may reduce the cardiovascular disease by about 30%. Just by reducing that, you go and see a doctor, he tells you stop eating salt. 30% incidence of cardiovascular disease, stroke, or renal failure is reduced. Now, in adults and children with no acute illness, a decrease in the intake of sodium from a typical high level reduces blood pressure by at least 50%. Now, it's always nice to have a low sodium diet in whatever food that you are eating.
Right.
That is, if you can, don't put salt. And if you can, all your veggies, don't put any salt. They've got their own innate salt inside there, and that's what you really need. Your human.
So God has provided this.
Yeah, God has provided all this. Now, the World Health Organization recommends that adults should consume less than 2,000 milligrams of sodium. And then, now, that is contained in about 5 grams of salt per day. Now, guidelines by the United States recommend that people with hypertension, especially the African Americans, and middle-aged and older adults should limit consumption to less than 1.5 gram, which is 1,500. 1.5 microgram, which is 1.5 milligram per day, and meet the potassium recommendation of about 4.7 per day with a healthy diet of fruits and vegetables. So that's why we always encourage the DASH diet with hypertensive patients, which consists mostly of 30% fruits and 30% vegetables and 30% protein and fat, and then a very little carbohydrate, which we all need. So the DASH diet will satisfy all these requirements of having not to suffer from high salt intake.
All right. Let me just stop you right then. We will come back to you. Lynette, I see you. Alles van die beste met die competitie, the radio pulpit competition. All of the best, the Pitch Your Business competition. And here's a question here from a family member, Dr. Tlailane.
Yes, ma'am.
Auswangi Dumela, can you please ask Dr. Tlailane about prostate enlargement treatment? I'm 43 years old. I'm feeling difficult in passing urine and having thin stream of urine, but I don't have burning pain while passing urine. I was asking what food to avoid and what treatment to take. Alrighty then. We did mention that you can stop us at any given moment in time and ask any medical issue that you have, and Dr. Tlailane will minister unto you. So he's 43 and feeling difficult in passing urine, having a thin stream of urine, no burning pain yet, as well passing urine. So he's asking himself what food to avoid and what treatment to take.
Okay, fine. I think these are the symptoms of either hypertrophy of the prostate, which can at a later stage maybe turn into cancer of the prostate. I would advise that he must go and see a doctor who's going to do a digital rectal examination, and they should do PSA at the same time. But the diet that he can be on is the diet which is less fat and more fruits and vegetables, and avoidance of alcohol, and I'm sure she doesn't smoke, and then avoid smoking and exercise more often. 30 minutes walking every day, Monday to Friday. That should sort it out. And they will also do some urine tests to see if he hasn't got an infection, because this can be caused by an infection in the prostatitis.
It's not necessarily prostate cancer.
So they will do
prostate getting enlarged because of cancer. Yeah,
that's right. Yeah, and then they will do the urine analysis, microscopic culture, and sensitivity to see what antibiotic will be convenient for him, and then
Can a man tell when the prostate is enlarged?
Yeah, you can tell, because already he's got a problem of urination. The stream is a bit big.
So one cannot feel the enlargement itself.
No, you can't feel it yourself.
But you'll see the signs and symptoms. Yeah. Okay.
The main signs are low stream urine, as she mentioned. There could be some discomfort when the bladder is full, and then there could be some blood. But if there is blood, then it's more serious. You need to see a doctor quickly.
Okay. ASAP.
ASAP, so that they can do that digital rectal examination, do an ultrasound. If need be, they will do prostate biopsies just to exclude cancer. So that if it's just a benign prostatic hypertrophy, then that can be treated medically.
So I've heard of others who their stream kind of has got what do you call that? It comes in staccatos.
Yeah, interrupters.
Then
Yeah, that's right.
what's that?
No, that's how the prostate acts. Because remember, it irritates the valve where you release the urine to pass.
Okay.
You know? And then if that is infiltrated with either inflammation or cancer cells, that sphincter is not going to be functional. It's not going to function 100%. You'll pass urine, or sometimes what will happen is the sphincter will close and then the bladder will be enlarging because you're putting urine in what you call in the bladder from the kidneys. And then you go to the loo and then you try to urinate and then there'll just be nothing coming out. And then that's when the pain will start. And then that's also one other indication that you should see a doctor so that they can put a pipe through this to relieve you of.
I know we're still on salt, but that also happens to some women. What is that?
You mean what?
That kind of a stream when they're passing urine and then suddenly it stops, but there's still more. And then they have to press again.
Yeah, that's one. You've got a pelvic inflammatory diseases. And then that will cause you those symptoms. And then especially if maybe the infection or the inflammation, whatever causes that PID, has spread to the urethra. Now the urethra is very short in the women. And then if there's going to be any problem with the urethra, you can easily have retention of the urine, or the opposite, which is incompetence, where incompetence, where you can't hold the urine.
Incontinence, yes.
No, did I say incontinence? Sorry.
Yes.
Yeah, where you can't hold the urine.
Yeah.
Then it just flows. Yeah. So with the women, it's mostly because of the pelvic inflammatory disease or an infection.
Are those the UTI?
The UTIs, yes.
Okay. All right, let's take a break. We're coming back with Dr. Tlailane. You can ask your questions. 01233413322 is the number that you can dial and talk to us. Alternatively, you can write even on our Facebook. We're streaming live. And we are on WhatsApp as well, 0826572729. And our SMS line, 37871. Ons kom terug. Those are the sounds of Halal Africa featuring Kamisha Dean. He's been good.
Reis saam met Radiokansel deur die Heilige Land Israel en beleef ook dele van antieke Egipte tydens ons toer na Israel. Besoek die piramides van Giza en die Sphinx en vaar saam op die Nylrivier. Beleef ook Nasaret, die see van Galilea, Bethlehem, Jerusalem, die tuingraf en nog vele meer. Toer saam vanaf 28 April tot 10 Mei 2023. Sitplekke is beperk. Kontak Bram Steyn by Stargate International op 011-918-7567 of stuur 'n e-pos na info@stargateinternational.co.za. Ontdek die woord van God opnuut op hierdie lewensveranderende toer.
The Ekurhuleni Worshippers Forum and Aubrey M. proudly presents the Unite Experience Volume 4, featuring Putuma Tiso, Michael David, Mpumi Mtweni, Kaila Keskosana, Bongiwe Matela, Gundo G, Koliwe Kanga, Bafana Mazibugo, Gauhelo Kekana, Yvonne May, Blessing Jedata, Ntomzoto Mahlangu, and many more. The event will be hosted on the 1st of April 2023 at Oasis of Life Family Church in Davidton. Doors will open at 1 p.m. and tickets are available at Web Tickets, and you may also secure your ticket by deposit to the Capitec account 128-569-8876. That's 128-569-8876, or by cash sent to the number 082-868-0745. That's 082-868-0745. Remember to put your name and surname as your reference, and make sure you produce the proof of payment on the day of the event. Let's unite, let's fly, let's be together.
From your ear to your heart, to your mouth, to your feet. Join this life on 657 AM.
It is 6:57 a.m. Radio Pulpit, your daily companion. 23 minutes it is, just after 10, right here on Just For You with me, Sibongile Mofokeng, with you up until 11 o'clock. It is near the end. That is Huis Besoek. My Dr. Tlailane. We are live, streaming live on Facebook, and you can talk to us on Facebook. Right there on our live stream, we'll be able to read your question, and Dr. Tlailane is still in the house to can answer your questions. You can drop us a WhatsApp or a 657-2729 or 37871, which is our SMS line. Alternatively, you can call in. Let's take that call right now, and then we're coming back to Dr. Tlailane talking more about salt. Hi, family. How are you?
Hello, Sister Bonnie, and thanks for the song. Our God is good indeed.
He is a good God all the time.
Hallelujah.
Babu Vilagazi, good morning.
Ngiyabulisa kuDr. T lapha.
Molo baba Vilakazi kunjani?
Fine, how are you, my brother?
No, I'm fine. I'm also
Ngiyabona umntwana ukhula kahle lapha
yakhula.
Sikhuluma nomkhulu Tlailane. Umkhulu Tlailane.
Uyakhula umntwana ukhula. Hayi.
Yabo.
And usezandleni ezomfutho ezaziyo ukuthi fanele atholeni nani.
Yeah.
I have two questions today to ask you, Dr. Tlailane.
Yes, man.
Is it true that some over-the-counter medicine contains salt?
You?
Number one.
Okay.
And tinned vegetable, is it safe to use?
What about the frozen one, Babu Vilagas? we have tinned vegetables, and we also have frozen vegetables. I think let's ask him on both. But thank you, Babu Vilagazi.
Thank you, my sister.
Thanks, Baba Vilagazi, for your call.
Thank you, Dr. T. Thank you.
Right.
Mm-hmm.
Okay, look, the first one is a salt.
It's salt, prescribed medication over the counter.
Yeah.
Do we have?
I'm not sure. You know, those medications or over the counter.
Yeah, boo.
Yeah, over the counter. I'm sure some of them have got salt.
Some salt content in them.
The ones which are ethical, which have been approved by PRASA, contain zero salt.
Okay.
Unless it's some other supplement that we want to also supplement the salt inside, then you will get some.
But it should be written, isn't it?
Yeah, it should be written.
Everything should be written on those pamphlets that are inside.
Our medicines don't contain salt at all.
Okay.
And then tinned vegetables,
Yes.
I can, without any doubt, say they've
Definitely.
got a very high content of salt.
Definitely.
That is what is giving them this taste And then that is what is giving them this love of being, affinity for people to really want to buy them because of the salt content. And the frozen one, at least frozen veggies, are not fortified with salt. They are just taken from the garden.
They've been pre-boiled.
Yeah, that's right. Pre-boiled and then put
So they
in
are safer.
They're safer. They're safer than the tin ones. So if you want a mixed veg or something like that, I would say go for the frozen ones than
the tinned ones.
But check the expiry date, because some of them can suffer freezer burn, which is not healthy for you.
Okay, the family member who is 43 years old, who is talking about the urine stream, now is asking, also recommend doctor, which doctor to see currently. Attending Barra Hospital, may get help there. About prostate, he's asking if he can't get help. I believe he should.
Yeah, he should. He can go to Barra and then at the outpatient, well, he'll be seen by an outpatient.
They'll
doctor.
screen him at the
they'll
outpatient. If
go
he
to
needs to be
urologist.
admitted, then
And then he'll see the urologist.
the urologist.
That's right.
Yeah. All right. So
Barra have got very good urologists. So
yeah,
visit
and I
sometimes.
know that they are taking, I nearly said precautionary measures, but I know that they are so, like, they've been raising awareness on cancer, prostate cancer,
Yeah,
breast
that's
cancer. They even have oncologists, department that's dealing with that.
Yeah,
So,
actually, they're the first hospital to have introduced robotic surgery for
Ah,
prostate.
is it?
Yeah.
So he will
That
be
is in the States, you see
so
that.
he will be in
We did have
good
it
hands.
in private, but Barra is the
Has
first
that.
one.
Oh, so he will be in good hands.
Yeah,
Okay.
definitely.
A family member says, I have got carpal tunnel. Okay, I've got carpal tunnel, bad in left hand. What advice can the doctor give? I took coxfiam tabs.
Coxflam.
Oh, coxfiam.
Yeah.
Flum.
Yeah.
All right, it looks like an I. Okay, I see. It's an L. Coxflum tabs.
Look, I think she's referring to carpal tunnel syndrome. It's not bad. Now, carpal tunnel syndrome is that condition where your nerves at the wrist are trapped by the fascia, which holds your tendons together.
Ah.
Yeah. And then it causes a very excruciating pain. The best is to go and see your GP, who's going to refer you to an orthopedic surgeon.
Uh-huh.
Now, treatment there, unfortunately, it has to be surgery. They have to relieve that pressure which is caused by those to the fascia, which is compressing the nerve. There's a radial nerve, and there's an ulnar nerve which passes through that tunnel there. And then once it's inflamed, then that's when you are going to get pain from that wrist. And then it's called carpal tunnel syndrome. It's very excruciating.
Now, the advice you have for her?
You must go and see his general practitioner, who's going to refer him to an orthopedic surgeon. And the orthopedic surgeon is going to release the pressure by operation.
Ish.
Yeah.
Yeah. Okay. Family member, all of the best, because I can just feel the pain that the family member is talking about, saying very in the left hand, you know.
Yeah, it's very excruciating. Look, it's the radial nerve and the ulnar nerve which pass there, and both of them, if they're compressed by that fascia there, you know, you feel like you want to chop off your hand.
Ish. All right. Greetings to Nhlanhla, the CEO of Rice Radio, saying, I am tuned in listening. Thank you so much for listening in today. So humbling. And then another family member says, Thobela Sibongile, Dr. Tlailane, nna ga ke sa ya matsatsing a basadi ke na le 45 years. Na. Okay, I'm not quite sure. Yona a ke se mpakele bolwetsi jwa cancer na. Oh, okay. They are no longer going on their periods. She no longer goes on her
that's
periods.
right.
She's 45 years old. And she's wondering if this cannot, affect her and give her cancer in one way or another. Is it possible?
No, it's not. Okay, we do have some other postmenopausal cancers. And the common one is that of endometrium. That is the womb inside. That is the commonest cancer after, postmenopausal. But that your postmenopausal doesn't predispose you to any cancer.
You reckon she's postmenopausal at 45?
Well, you can start at 37.
Okay.
Yeah, there are
Mara,
women.
she can also be perimenopausal because she can start seeing her periods if she starts seeing her
No,
periods
if
again.
if the hormones go down and then she goes into perimenopause, she's bound to go to postmenopause.
Okay.
I mean, menopause, then postmenopause.
Uh-huh.
But at 45, I'm not surprised that she's postmenopausal.
So if we're saying she's menopausal, like she's postmenopausal, it should have been like she should have been there without periods for a year
for a year to 18 months.
to 18 months.
Yeah.
Then we can say
Then
she's post.
now she's postmenopausal. But anything between there, it's perimenopause.
Now, if one, okay, let's answer her first.
Let's lay fears on this lady.
Yes.
She thinks
It might lead her to cancer, and
which is
it's
not
not.
true. Yeah,
Yeah.
it won't.
Even the breast. What about breast cancer?
No, breast cancer too.
Yeah.
And then remember, breast cancer is dependent on the estrogen, and postmenopausal women have got very little estrogen.
Estrogen.
Yeah.
Uh-huh.
So they don't have, that greater chance of having to develop breast cancer because of the deficiency in estrogen.
Let me ask now for two women that I've met.
Yeah.
Another one says, I've never had my periods for like 13 months,
Yeah.
and then suddenly I'm sporting.
How old is she?
She's 40, way beyond 45.
Right.
Yeah. That's the first woman.
Yeah.
The second woman says, I am still seeing my periods.
Yes.
They have, what do you call it? They are no longer coming as usual. They're not as heavy all the time.
Yeah.
Sometimes they're very heavy. Sometimes I only see them for 3 days and they are gone.
Okay.
And then
How old is she?
she's 46.
All right.
This one, she's 46.
Yeah.
And then she says her breasts would be painful for more than 2 weeks, even after she has gone on her periods. So let's answer the two ladies.
Okay, the first lady, I think she's in a perimenopausal period now. Anytime those menses are going to disappear.
Can she fall pregnant still
She can still fall pregnant.
with the sporting?
Yeah, with the sporting.
Okay.
And then what she has to do is just to go and do some menopausal profiling to see how much estrogen, how much progesterone she's got.
Uh-huh.
And then also the luteinizing hormone, which are responsible for the withdrawal bleeding, which comes with menses.
Mm-hmm.
If that can get checked up, then she'll be okay. But she will go into menopause.
She's just 5'2"
yeah,
menopause.
that's right.
Sure.
And then the second lady at her age, I think she must be done an ultrasound to check if she hasn't got any polyps or any myomas within the endometrium, because it's acting weirdly in that sometimes it pours, and then she's got this painful breast, which can be explained by the high estrogen content, which is produced in the adrenaline or in the ovaries.
Yeah, so
But
then
that
she
is-
says sometimes the pain goes,
Yeah,
then 1 month again, it's
Yeah,
back and the
that's
breasts are heavy.
that's right.
Yeah.
But if you can just undergo an ultrasound, they'll check the endometrium, and they'll check the ovaries, if she is ovulating or not, and they can always find out if there are any growths within the uterus which cause this weird bleeding.
All right. So it's not. It has nothing to do with being
Menopause.
perimenopausal
No.
and the
Well, the second lady
hormonal.
confuses a little bit because the age.
Yeah.
The age says she's perimenopausal.
Yeah.
Yeah.
Okay. All right.
We can also do some hormonal profiling on her, menopausal profiling, to see the state of hormones.
Okay.
Yeah.
But she's also 5'2". Okay, maybe 10'2" this one.
No,
Got
maybe
it.
she is. That's why we have to do that ultrasound to exclude
All-
any organic
Yes.
cause
Yes.
of her breakthrough bleed.
All right.
We call it a breakthrough bleed. Yes.
All right. Greetings to Muruti Sipo Georgia. Thank you for tuning in and being with us. Family, remember we're talking salt. Anything salt, and we are raising awareness on salt and how the importance of it and the dangers of it, how much you need to consume on a daily basis. And we are open for you to can ask any medical issues that you have that you'd like Dr. Tlailane to explain or help you with. So the lines are opened on 012-334-1322. It's 012-334-1322. Alternatively, you can drop us a WhatsApp on 082-657-2729. It's 082-657-2729. And you can also send us an SMS, 37871, and you'll be charged 150. Or you can talk to us right there on the live stream. What more do we need to find out about our salt intake, Dr. Tlailane?
Okay, you know what? There is one thing which I want to say, and that is one of the two most prominent dietary risks for disability in the world.
Okay.
Are diets high in sodium and potassium.
Okay. You said you mentioned disability, which was highlighted.
Yeah, disability.
Yeah.
Can be any other disability.
Yeah.
Yeah. It can be associated to the high intake of salt. I'm not sure how the researchers really come to this conclusion. But while reduction of sodium intake to less than something like 2,000 to 2,300 milligrams per day is recommended by developed countries, one review recommended that sodium intake be reduced to at least 1.2 milligram for optimum development of any tissue. And then if you're going to be disabled or something like that, and then a research is done or investigation is done, somewhere they're going to find that there was a high salt intake.
Yeah.
I don't know, but that's one research. And another review indicated that there is inconsistent or insufficient evidence to conclude that reducing sodium intake to lower than 2.3 micrograms per day is either beneficial or harmful. So we never know what to follow, whether we should just stick to 2,300 or reduce it to 1.5, or whether this high salt intake will cause any problem in your body, predisposing you to a disability. Well, a disability is something that can cause a chronic illness and then make you not be functional.
Stroke.
Not really, I mean, a stroke is a disability, heart failure is a disability, and then if you develop anything which will impair you to be able to can perform your normal
highest,
then it's a disability to you. So that is associated with salt. So I would say, to be on the safe side, switch from, if you want the taste, switch from salt, pure salt, to what do you call this thing now? Spices.
Okay.
Yeah. Those spices have got their own problems too. They predispose you to peptic ulceration. Yeah. So, but to be on the safe side, especially when it comes to metabolic disorders, stay away from salt and then use cinnamon is number one. I like cinnamon. Just sprinkle it a little bit.
Cinnamon is medicine anyway.
Yeah.
Cinnamon
At
is
least it will
medicine.
give you that taste that you want.
I know if you got honey and cinnamon, bona. But now, Dr. Tlailane,
Yes.
here, this is what a lot of people do
Yes.
in their homes, especially those with blood pressures and those who are told to stay away from salt.
Yes.
They buy the, what do you call them? Stock.
Stock,
your
spine,
chicken
that-
stock
Yeah,
and
okay.
your
That-
beef
those blocks.
stock. Yes.
Yes.
And they use that in place of salt.
Yeah.
Is that maybe
Yeah,
better
that's what I
to
was
do that?
suggesting, yeah.
Or is it worse because you don't know how much salt is in that stock?
No. At least it hasn't got that high, the content of
Compared
sodium
to
chloride.
to the whole spoon.
Compared to the spoon that you are going to use, you see.
Mm-hmm.
So I would encourage you that, like if you make, I used to fry tomatoes
Yes.
with stock only.
Yeah.
I wouldn't put any salt, and then it gave me that taste,
Yeah.
and I loved it.
Yeah.
You see,
So it's much better
it's
to
much
do
better.
that.
Yeah, that is switch from salt, pure sodium chloride, switch to donor
But is
stocks,
it safe for people with high blood pressure, hypertension?
No, if you're hypertensive, avoid.
Rather measure your salt.
Yeah, because the effects of spices and salt on fluid retention is the same.
Okay.
If you take salt or you take just ordinary spices, you will still retain fluids, which is not going to be good for your heart and then it can predispose you to at least nephritis, where your kidney has to function harder to get rid of all this salt by drawing the water out of your system to get rid of the spices and the salts and other things, which can at a later stage dehydrate you.
Okay.
And then God forbids you go to be dehydrated to an extent that the brain becomes dehydrated, and then you're going to be so delirious. So
can that happen?
Moderation, yes, moderation is a key. Anything that you put in your food, put it in moderation. Don't put a whole spoon of... I've seen people salting the biltong that they fry.
Hey. Biltong has salt, isn't it?
Salt already, yes.
So you fry it?
They put it in a braaier.
Okay.
And then they paint it with salty spice.
Yeah.
And then I see it in the township there.
Like what we would do with meat. Marinate it.
Marinate it, yeah.
A biltong.
A biltong, yeah. Well, I tasted it. It tastes good. But
it's dangerous.
It's dangerous.
It's dangerous good.
Yeah. That's right.
So be careful of what. All right. A family member writes in and says, Sibongile, I heard you and Dr. Tlailane talking about women issues. I'm sorry to diverge a little bit. I am also 47 years old. I don't see my periods regularly. Does it mean that it's time for me to take it easy? No more using contraceptives? And is it time for menopause?
Okay, at the age of 47, the likelihood of falling pregnant is less.
Taking it easy. I love that.
I never want to say no. Because I've seen a lady 51 who fell pregnant.
Huh?
Yeah.
Okay, did her period stop or not?
No, she had her periods, normally. And then somehow they stopped. She wasn't sure because they were just irregularly regular. So she wasn't sure whether it's a missed period because of pregnancy or not. She just continued and wouldn't be on any contraception.
And she thought...
And then she thought, no, I've gone into menopause.
Can't she's pregnant?
No, we did an ultrasound there.
And there was a baby.
There's a baby there. Unfortunately, the baby, is okay. It's normal. Because we discourage people from falling pregnant after the age of 40. Yeah. But it was all right. So she mustn't relax. As long as she's got those regular periods. Oh, no, she says she has
They're irregular.
They're irregular.
Yes.
Now you must be very careful of such.
They're the dangerous weapon.
Yeah. Because you think, no, I'm going into menopause.
Yeah.
And then you don't use any protection. Voila, the baby comes. Yeah. I would say wait for 1 year to 18 months that you don't have any period.
Yeah.
Then you can safely say, okay, I'm stopping these contraceptions.
Now, okay, thank you, Dr. Tlailane. I hope the family member got that. Now a family member is sending, I can't name that seasoning, because it's a brand. So I can't name that seasoning, but Dr. Tlailane, you see it.
Okay, I can see it.
Yes. So the family member is asking about another seasoning. It's yellow. We love it.
Yeah.
It smells good.
Yeah.
And she's asking about that seasoning. Is it good or bad?
No. That one is good because its salt content is not
very
that of
low.
the ground. Yeah, it's low and it's a sea salt. Yeah.
But you said there's no difference with sea salt and...
No, when it comes to the side effect,
Okay.
there's no difference.
Okay.
Yeah. But the sea salt, I'll go for sea salt anytime if I'm given a choice.
There's also garlic salt.
Yeah, well, if just added
It's
garlic.
pinkish as well.
Yeah. It's just like the
It's
iodized.
coarse.
It's just like, they've been fortified, all of them.
Okay.
Like we fortify salt with folic acid for pregnant women.
Yeah.
We fortify it with iodine for people who are elderly. With a fear of having to develop thyroid cancer. We fortify the salt with chlorine for people who are prone to dental caries. So this is all because of fortification, but the main thing is the sodium chloride which is inside there. And the main thing in that sodium chloride which causes problems is the sodium and not the chloride.
All right. Last break. We're coming to close when we come back with Dr. Tlailane.
Life does hurt sometimes, and we don't know what to say or how to pray. But although life gets hard sometimes and
Radio Pulpit invites all ladies, young and old, whether married or single, to join the Radio Pulpit Camp taking place from the 5th to the 7th May 2023 at Chakana in the heart of the Mabula Game Reserve in Bilabila. We all felt alone at one time or another in our lives, and we keep searching for connection. Come to the camp and find some answers. The theme for the weekend is Inquisitive Beauty that Desires the Fellowship of the Holy Spirit, presented by Pastor VTJ Masagona. The cost for the camp is 1,750 per person, and you're welcome to pay in portions or segments. An additional fee will apply for those who need transport. For more information or to book your place, contact Zandile on 012-334-1231 or email at zandile@radiopulpit.co.za.
Uthandwa ngendlela ongasokuze uyiqonde. Khetha iRadio Pulpit 657 AM. Luthando olo.
657 AM, this is where you at, and we gave you the sounds of Gerard Peace, and that is the husband to Mabongi Mabaso. And the song Hold Strong is the song that we gave to you. I'm Sibongile Mofokeng, it's just for you. We are just about to close with Dr. Tlailane. We've been talking about salt, our salt intake, and we've been learning, hoping that the family has been learning. I have been learning, and yeah, I was saying to Dr. Tlailane, he needs to tell us how to wean ourselves from abusing salt. Hey, because, yeah, we abuse before you taste.
Yeah.
So, as we're closing, Dr. Tlailane, what do we say to the family?
Okay, we've said a lot about potassium and sodium, but let me just explain the interplay of sodium and potassium. Sodium and potassium basically are closely interconnected but have opposite effects in the body. Both are essential nutrients that we need and that play roles in maintaining the physiological balance, and both have been linked to the risk of chronic diseases, especially cardiovascular diseases, as we have alluded to. Now, high salt intake increases blood pressure, which can lead to heart disease, while high potassium intake can help relax blood vessels and excrete sodium while decreasing the blood pressure. So that's the interplay between sodium and potassium. So if you can avoid the salt, which is sodium chloride, that contains sodium, that is the thing which is going to cause high blood pressure, and go more for things which have got maybe potassium, which can reduce your blood pressure to an extent. Yeah,
sure.
In simple words, avoid salt by all means.
Is it possible?
Yeah, I know that.
I mean, when we were young, there would be some adults that would even pour salt on your palm.
Yeah.
As a child.
Well, the body could handle it then. You had very nice kidneys which could get rid of that salt quick.
So avoid as much as possible.
Yeah.
All right.
If you can.
Thank you so much, Dr. Tlailane, for coming through.
Thanks.
And ministering unto the family. Kana, you're available between 6 and 9 in the evening.
Right, yes, that's right.
Can we call even at that time or just WhatsApp?
No. You can call. You can call. And then even during working hours, you can WhatsApp, and then I can, in between patients, I can reply you.
All righty then. All right. Thank you so much. May God awesomely bless you. Can't wait to be with you again next month.
Thank you very much, Bongi, and the family out there. Bye-bye.
Bye, Dr. Tlailane. And yes, family, if you'd like to be in contact with Dr. Tlailane, be it's via WhatsApp or via... what do we call it? Oh, you want to call him? Remember, you can call him between 18 hours and 21 hours. That's when you can call him in the evening. And his number is 078 738 2694. 078 738-2694. I'm signing out. You and I are going to meet again on Monday on Heart to Heart. Up until then, may the grace of our Lord Jesus Christ, the love of God, and the sweet fellowship of our Lord Holy Spirit rest and abide with you now and forevermore in Jesus' mighty name. I'm playing out with the sounds of Maverick City music and the song Sufficient for Today.